Hi, I'm James Paul Pilande of ARID Builders. Good afternoon, judges, ladies, and gentlemen. I'm here to present our solution to a very relevant but challenging problem we are facing now, the COVID-19 pandemic. Just recently, with overwhelming evidence, the World Health Organization has confirmed that the primary source of transmission of the SARS-CoV-2 virus is through aerosolized spray from infected individuals. Presently, at the Tan Tock Seng Hospital case, authorities are investigating airflow and ventilation as possible cause of this new cluster. As professionals in the built environment, we decided to develop the LumenAire, a device that can control the spread of the virus and make indoor air healthy and safe. Our technology is based on ultraviolet germicidal irradiation, which is safe to use even on occupied spaces. The device is an active fan to draw air through a series of filters, pass through an enclosed chamber, equipped with a high dose of UVC power, long enough to achieve the necessary exposure time of zero point 0.9 seconds to kill the virus. The disinfected air is then sent back to the room with a proven 99.9% effectivity. In line with CapitaLand's 2030 Sustainability Master Plan, our objective is to visualize, monitor, and control indoor air quality to ensure a healthy and safe environment for the building occupants. The solution should be affordable and effective, resulting to footfall going back to pre-COVID levels. Our vision, feel safe, stay safe, resonates with our value proposition. We make the air you breathe healthy and safe. The idea is to install an indoor air visual monitoring system in public spaces to provide peace of mind for its occupants, while the Luminaire will work in the background to ensure that the air they breathe is safe. We are confident about the effectivity of our device. And to prove our point, we would like to propose a pilot test for asphalt serviced residents to demonstrate our solution. Together with masking and social distancing, we expect a 99% decrease in viral risk in indoor space covered by the Luminaire. A healthy indoor environment is a good investment for the company, especially in times of COVID. If the pilot is successful, we hope CapitaLand will gradually roll out our solution across all of its properties in Singapore and overseas. As a testimony to our success, last February, we did a pilot test with LHN Group supported by Enterprise Singapore. We installed the Luminaire at LHN-operated hostels and conducted our pre- and post-test focused on high-risk areas like the study, gym, and breakout lounge. The feedback was convincingly positive, and the result was a purchase of the device for permanent installations in the hostels, as well as their corporate headquarters and other greenhouse service office locations. In a nutshell, I would like to take this opportunity to talk about the potential growth of the business. The UV disinfection market from 2021 to 2026 will be worth about $5 billion with a higher compounded annual growth rate of 14%, driven by the high demand in UVC and far UV equipment to combat current and prevent future pandemics. The high percentage of growth is in the Asia-Pacific region due to the adoption of stricter indoor air quality standards because of COVID. How will we make our presence felt? Besides innovation, our approach to ensure that the Luminaire will be in the forefront of healthy and safe indoor air globally is to adapt the counter-positioning model. We aim to challenge the status quo by adopting a leasing model where most are focused on selling. We are looking at it at an economic point of view. Are businesses really willing to make an upfront investment to how everyone perceives as a momentary event like the pandemic? Therefore, to make our products affordable, we develop a rental model that will fit in with the customer's perception and expectation. There will be drastic changes in the building code to strictly enforce tougher indoor air quality standards to prevent future airborne disease-causing pandemics from happening. Our team has already prepared for this eventuality by providing an option to purchase plan for continuity of service and to achieve business longevity. A well-known business influencer on Twitter once said, if a founder started a business at the middle of the pandemic, they are likely to succeed. Imagine the drive and determination we had in building a physical product at the height of our circuit breaker period. We will carry this grit and grind attitude to expand the business. We expect our company to grow by $50 million in revenue annually over the next 5 years, or roughly a 1% share of the global UV disinfection market, driven by our plan to scale far and fast across the ASEAN region in as little as 2 years and globally by 5. Besides Singapore, the Luminaire has started acquiring orders from overseas dealers in Dubai, Hong Kong, Saudi Arabia, Malaysia, India, and the Philippines. We should not let COVID dictate how we live. Our team is proud to be a finalist in this competition, and rest assured that given the opportunity, we will make the air you breathe healthy and safe. Thank you.
Let's go.
Yolande. Our first question, and your 7 minutes also starts with Mr. Rohit Sipa Himalani.
Hi, James. Thank you for your presentation. As you said, this is very topical today. We are all concerned in this COVID environment about air quality. One issue, of course, is that there are no real measurement standards for indoor air quality, and what is good enough. And the question for you is, therefore, in terms of selling your products, are there guarantees you can give on indoor air quality? And if so, what would such a guarantee entail?
Yeah, basically that's why we came up with a solution. Instead of just selling the product, now we have the VMC solution, which stands for Visualize, Monitor, and Control. So basically, this monitor, is being installed outside of the, public spaces to empower people to see the air they breathe. So basically, we spend 90% of our time indoors, so we need urgent visible problems to act. We have to shine a light by making the invisible visible. So once we care enough to track the IAQ, we have some understanding of the problem, and then we can plan to stop it. So this is what the LumenAire does. Because most of the time, people will ask us, how sure are you that your device is working? So this is why we installed an indoor air quality monitor for us to showcase that it's working. That's how we do it.
Got 5 minutes and 15 seconds. Rushad is up next with a question.
It's along similar lines. When you flash that dashboard up, James, and the result was really impressive, right, with respect to the virus index. But what sort of assurance can you give that change was in fact driven by the LumenAire product and not by the major drop in humidity or PM 2.5 levels that you also saw alongside? I just want to make sure that we're kind of being rigorous about thinking about sort of causation versus correlation. I'm not a virologist, so that was the obvious question that came to me when you flashed that up on the screen.
Yeah, so basically what we do when we approach our customers or our clients is we present a pre and post test, like what we did in LHN. So basically, we try to, as much as possible, cover everything. You know, we will install an IAQ monitor first for them to monitor the current indoor air quality against after we install the luminaire. Anyway, the luminaire also, besides having the UVGI, they also have filters like a HEPA filter, carbon filter, pre-filter to at least, kill all the other pathogens besides virus and bacteria. Yeah.
We got about 3.5 minutes. I think maybe time enough for two quick questions. The next question is from Chris.
Okay, really quick question. So you're putting filters in, which means that has maintenance implications. How often do you anticipate you're going to need to flip out the filters?
The filters, can be replaced in 3 to 4 months for the HEPA filter, and then for the carbon filter, it should be from 6 months to 1 year.
Right,
Also,
do you
of
have,
course,
okay, stop. Do you have an indicator? Is that a smart filter so that you can tell the maintenance people when it needs to get flipped out, or is it just you just can go by and do it?
currently we don't really have it yet, but we are working on it. We are working
Okay.
on filters.
Cool.
For the,
Okay, that's good. So I like the emotional, the facts, and the impact. I think that's really good because many renters want to know that we're taking care of them. And this is a very important part, which I do like with that. How easy is this to integrate into existing systems? Because we don't need all of a sudden do all sorts of new systems, right? So we want to be able to integrate this. How easy do you anticipate it to be integratable?
currently, the indoor air quality sensor that we are using is being used already in the US and in the EU. So basically, what we just need to do is we have to tap on them in order for our indoor air quality sensors to trigger our devices to act. So all of this is all cloud-based. So that is how we can integrate it together with
Are these then added in the stream into the ductworks, or these are added onto the walls? This
No,
kind of,
it's a plug and play system. So basically, in order for us to connect it over to the indoor air quality sensor through Wi-Fi or through cloud, we have to put it over into a smart plug. So this smart plug will be the one that will enable all these devices to work harmoniously together with the indoor
Got
air
it.
quality.
Okay, cool. Thank you.
No
Okay,
problem.
we have 1:30. I'll throw it to one of the judges that are live in Singapore here. Any question for Philande?
Yep.
Could you use your microphone? Yeah.
Just a follow-up question. You talked about your leasing model being unique to sort of help people adopt this. But have you thought about the implications on your own business model, about the capital requirements, and why you think that this is something that you'd be able to sustain?
Basically, that's why we use the leasing model instead of the purchase model. It's because for purchase model, it will be outright capex. But if it will be on the leasing model, they have an opportunity to try the device, and it will go through the operating expenses. And then at the same time, they have an option to at least try and be convinced that our device is workable, and to prove its worth. Yeah.
But it significantly increases your own capex requirements, right? And I'm just wondering, have you thought about it in terms of the economics of your own business model, whether it can be sustained?
Yeah. Okay. Most of our like the screen is also we rent it and then we rent it out. Even the indoor air quality sensor, we rent it and then we rent it out. So the only capex that we have is our own luminaire. So basically, that's why we do that, is because we have to adapt to a more counter-positioning model, and at the same time try to match the current economies now, which is more into subscription, into more is to rental rather than outright purchase. Because most of the companies are doing outright purchase, but for us, we are trying to do the rental model, so it will be for us. It would be more affordable. Currently, we are experiencing a good, response in our rental model. Yeah.
All right, that's all the time that we have for now. Thank you very much, Mr. Pilande, and thank you indeed for
Thank you.
for the
Thank you
sharing
for
by
your
ARID
time.
Builders, the sharing of LumenAire, an indoor air disinfection solution that reduces virus survivability by over 99% within just a few seconds.